Hi guys, this is Wes with Still Real Game Fowl, and in this video what we're going to talk about is giving shots. This is Zeus. He had his eye put out a while back in a pen fight, and I've been giving him some shots and stuff, trying to get that swelling to go down, and I've got it to go down quite a bit, but it doesn't seem to be going away. So I'm starting him on a new regimen of penicillin, and I'm going to try to get his infection to go down. And what I'm doing right now is I'm trying to pull the infection off his eyelid. He's not being very cooperative. I'm sure it's very sore. Yeah, he's got a good bit in there. So pretty much what we're going to do is we're just going to give him a shot of penicillin and clean up his face a little bit. First off, what you're going to need, you're going to need a clean, disposable needle. What I use is a 3cc 20 gauge needle. And that's what I use to give my penicillin. Penicillin needs to be refrigerated. Penicillin needs to be refrigerated and shaken up right before you give it. So what we're going to do is we're going to start him off. I'm thinking probably about half a cc, I would say. So you're going to fill your, for those of you that don't know how to draw shots, you're going to fill your needle up. I'm going to let the camera focus here for a second. You're going to fill the needle up just a little bit past where you're wanting it. And what you're going to do is you're going to tap it to get all the air bubbles up to the needle. You're going to push just a little bit out, right to the point where you want it, to make sure all that air's out. So then what we're going to do is we're going to take Zeus here, and we're going to find his breastbone, which you should have a little knot right where the breastbone is. We're going to go to the well, I'm going to go to the right of it, just because I've been giving it to him in the left side. Well, it'd actually be his left, my right. So we're going to go on above his left leg, in the left breast, and we're just going to push real fast. It's in there, and penicillin's pretty thick, guys. So when you give it, you might have to push a little harder. If it still doesn't go, back off just a little bit. Back the needle out just a little bit. And it'll go once you don't have anything blocking the gauge. There it goes. So we're going to give him half a cc into the breastbone. And just to make sure that it gets up to where I need it to go. I know it will if you give it in the breast, but just for video purposes, I'm going to go ahead and do this too. There's also another injection spot that you can give right here on the back of the neck. This is preferably done with two people to hold it. After you do it for a while, you can pretty much do it on your own. All you have to do is take your needle at the crick of the neck, and you're just going to go under the skin, not into the muscle. So you're going to find a nice clean spot. Alright, we're in. And that's it. You just want to go underneath the skin on the neck. You don't want to go into the muscle. You could hit his bones in his neck. He could hit his spine. You could really mess some stuff up. So it's very important that you take your time whenever you're giving shots. You don't want them to start kicking and everything. If the bird's uncomfortable getting stuck, they're going to kick, they're going to squall, they're going to scream, they're going to try to fight you, and you can get stuck with the needle. That's why you always use a clean needle. After you're done with your needle, you're going to cap it back off, twist it off, and discard it in the proper waste area. I actually have a bag up here just for needles. So after we've got him juiced up with some penicillin, what we're going to do is we're going to take a clean rag. This is just what I'm doing for the eye. I just want to include this in the video. We're going to take a clean rag. Oh, hush. And we're going to clean off his eye from where that pus and stuff has been coming out. And they're not going to like it. It's going to hurt. But it's healthy for them to get it cleaned out and keep it clean until that medicine can take hold and get that infection out. The reason that I do know that it's infection and not just swelling is because I've been putting Preparation H on his face, which should help the swelling go down, but it hasn't. But just for other purposes, I'm going to put a little bit more Preparation H on him, if I can figure out what I've done with it. Since that's one of my most used things, I have no earthly idea where I put it. Oh, there it is. Oh, it slid off the table. So we're going to take a little bit of Preparation H. Woo. And we're going to rub on his face here. Around his eye, not on the eye. If it gets down in that crack, it's going to make him if it gets in his eye, it's going to make him very uncomfortable. So just do it around his eye. And he's ready to go back out on his tie cord. Again, when you're giving shots, it's very, very important that you don't get any air inside your shot. If you push air inside these birds, it could kill them. So you want to avoid pushing air into your birds. It's not healthy for any animal to have air inside their body, other than their lungs. So what you want to, again, just be careful whenever you're giving shots. Take your time. Make sure you have a good injection spot. Never push the needle all the way in. You push it all the way in, you could go past the muscles and hit something very, very important and kill your animal. So push it in just to get it inside the muscle and inject it. If it doesn't inject right off, pull just a little ways out and then inject it again. All that is from where the needles got either skin or muscle inside the tip of the needle. So once you unclog it, it'll go just fine. Penicillin's very easy to use. You put them on a regimen. This guy right here, he's going to get another shot in about 2 days. And after that 2 days, he'll have another shot 2 days after that. And then he'll have a final shot 2 days after that, which would be a whole cc instead of just a half. By then, his eye should be pretty much healed up. This old boy's had his streak of bad luck, but hopefully all that's over. But like I said, I can't stress enough of be careful when you're giving shots. Don't put anything in your birds that you wouldn't want somebody to put into you. So make them as comfortable as possible. Don't do it by yourself if it's your first time giving shot. Don't do it by yourself. Learn before you attempt it. You can put it in the left or right breast, behind the neck, in between the leg. You can put it in the leg, but if you do it in the leg or in the wing, do a drawback. What a drawback is when you insert it, you pull back just a little bit. If you have blood return, find you a different spot to go in, because that means you're in a vein or an artery. If you inject some medicines into the veins or the arteries, it can kill your animal. So whenever you're doing your drawback, you just want to pull back a little bit. If you have blood come up inside your syringe, find a different injection spot. It's very important that you all know this for whenever you're giving shots. You don't have to so much worry about blood return in the breast muscle or giving it to them in the skin. But whenever you start going into areas with a smaller amount of concentration of muscle, you have to start worrying about veins and arteries, like in the legs and wings and places like that. You just have to make sure that you know what you're doing before you give a shot. Just go over the video, look back on how I done it. Another thing is, whenever you insert a needle, you always want the opening of your needle to be pointing up, pointing away from the skin. This will allow it to glide right in. If you point it down, sometimes it causes a little bit of trouble once you get it in there if it's pointing down. It's also a little bit more uncomfortable to the animal. So, needle opening, pointing up, slide in, inject, done. It's that simple, that easy. Just be careful when you're doing it. Use caution. You are using a needle, and it can go in you. I've seen people get stuck by a needle and get very, very, very sick from the stuff they were injecting in their animals. So just be cautious whenever you're doing it. You can get, as far as penicillin goes, this is the type of penicillin that I use. You can buy this penicillin just about anywhere online that sells game fowl supplies. You can get a bottle like that for about $12. They're very cheap. This is a lifesaver. If you have animals that get hurt, you got penicillin. If you have animals that get an infection, you have penicillin. You have the equipment. This is part of standard equipment for any person that raises game fowl. Any animal at all, actually. This is crucial equipment. Another thing is, I'm going to go ahead and pull these out here real quick. Have you a very strong, good supply of sterile, non-used needles? It's very important that you have plenty of needles, different gauges. The most that I have, one type that I have, are these 1 milliliter syringes. What do you call that? I can't even remember. This is a 25 gauge needle. They're very small. It's very easy to use for different types of medicines. But for the thicker medicines like B12 complex or penicillin, you want to use a larger gauge. Just for the thickness and the potency of the medicine. But like I said, just have you a good supply. If you're going to be doing all the stuff on your animals yourself and not having a vet do it, or something like that, or someone that knows about what they're doing, have sterile needles. Invest in sterile needles. You can buy these boxes right here at a medical supply store for like, I think you can get these boxes for like $30, and they come with, I don't even know how many. It contains 100 of these. So for $30 you get 100 needles. That's more than enough to last you for a while. Have sterile needles. It's unfair to your animals to use an unsterile needle on them. Anytime, tomorrow I'll use a different needle on him. The next day, the next day, the next day, the next day. After I use a needle, it's done. If I put medicine in it, and I put it in a bird, that needle gets thrown away after I use it. If you cross-contaminate your animals, you could have, let's say he's carrying a strain of pox. He's not, but let's say he is. Right now, it's recessive, it's not showing. I don't know he has it. If I stick that needle in him and give him half of a shot and then pull that needle out, grab another bird, and then give another half to the other bird, I just contaminated that bird with that pox. 3 or 4 days later, he's broke all out in pox, and you've got another issue on your hands just from you trying to cheap out and not use a sterile needle. Things like that's very easy to avoid. Just don't, I preach this all the time, don't cheap out on your birds. Don't cheap out on them. They do everything for you. They give you eggs, they give you chicks, they perform for you. Don't cheap out on them. As soon as you do, you're going to get cheated. You're going to get cheated. It's that simple. So anyway, that's how to give shots, in my perspective on it. Be careful. Use clean needles every time. Know the medicine that you're giving. Know the right amount and the right dosage to give. I wouldn't give him 3 cc's of this. It will kill him. It'll eat it. What it'll do, penicillin eats out the muscle. Once you inject in one spot, 2 or 3 days later, that muscle's going to be kind of flabby and corroded, if you would. So, you want to choose a different injection site, even if it's, an inch below where you injected the last time. Know your medicines, know how to give them, or you can kill your animal. Study up on the medicines that you use, or that you're going to use, before you start using them. Other than that, that's the video. I hope you all enjoyed it. I hope I taught you all something. As always, this has been Wes with Still Real Game Fowl, and I hope you all have learned something, and I hope you all have a good day.